Okay, in this section, we're going to look at some studies that have to do with the importance of core stability and muscle strength. Muscle for stabilization is key for spine and joint health. That's kind of the bottom line for all of this. Trunk muscle imbalance and risk factor of low back pain. There was a 5-year study done in the Journal of Network System Management. So they took 144 patients and tested their trunk muscles, and the strength and all that was evaluated, including range of motion in all directions. Those that had a low score with, the muscle strength and all the muscle testing they did, had a 340% increase risk for low back pain. Now, I've been practicing a long time, and I can tell you that most people that come in with low back pain, now keep in mind this is non-traumatic. Okay, so just your low back pain that develops over time, they are very weak in their core. So we do all these treatments and we do things to get them better, from spinal decompression to dry needling, adjustments, soft tissue, electric stem, all the classics for treating musculoskeletal problems. Once you get over that initial phase of getting them stable, getting them functioning better, moving better because of the treatments, now you can start to do the rehab. Extremely important that they do this, and once they do, they become more stable and their back pain declines even more. Okay, this one, Sports Medicine Journal 2002 by Cohen. Chronic low back pain patients have deficits in trunk muscle strength. Okay, so a normal extensor muscle to flexor muscle ratio should be 1.2 to 1.5. Okay, so your trunk extensors are basically your low back muscles, and your flexors, your trunk flexors, is basically your core, your abs, your abdominals. Okay, in Spine Journal 1999, 412 patient trunk muscle were analyzed. In chronic low back pain patients, the lumbar extensors are likely to have a deficit. The multifidi, which we'll look at those later on once we get into gross anatomy, and these are the muscles, by the way, when I do dry needling of the spine, I primarily target these multifidi muscles. So these are used mostly when the spine is in extension, which means you're extending or arching your back. That's extension. On MRI, you will see a fatty infiltration of these lumbar extensors. It has a marble color appearance to it on MRI. And so the MRIs that I order and view, especially with my chronic low back pain patients, you can really see that fatty infiltration, that marble color getting into that muscle. Very weak muscle at that point. Does not stabilize well. The more severe the back pain, the more atrophied the muscle and the more fat was found in the muscle. In this study, EMG and CTs were used to assess this. And then those who received treatments, which were adjustments and rehabilitation, showed marked improvement. Okay, this certainly exceeds just doing painkillers. Okay, now I get it why people take painkillers, because back pain, it can be very debilitating. But cortisone injections and painkillers, I also know, do not fix the underlying problem. What fixes the underlying problem is adjustments, rehab, PT stuff, and strengthening. Okay, Bogduck, one of my favorite researchers, out of his Clinical Anatomy of the Lumbar Spine and Sacrum, the intertransversi and interspinalis muscles act as large proprioceptive transducers. Okay, the intertransversi muscle is a muscle that goes from transverse process to transverse process in the spine, and the interspinalis muscle are muscles that connect from spinous process to spinous process on your spine. These are things we'll look at later once we get into gross anatomy of muscle. But these muscles do act as large proprioceptive transducers. Now, this proprioception is your balance center. This is what helps you keep your body in alignment, stable. Sends feedback to your brain to let you know what proper posture and position should look like. And one way to assess this is on an exercise ball, which I'll get to that in a second. Okay, these tiny muscles provide feedback because of the muscle spindles they contain. The muscle spindles is what I go after in dry needling. That's the hot spot in a good way. You stimulate that muscle spindle, you are basically resetting the proprioceptive activity from brain to body and body to brain. And those tight, spasmed, hypertonic multifidi muscles are now reset, and so they're stabilizing better. They're more receptive to treatment, and they'll respond better. Failure to recruit these muscles results in low back pain, weak muscles, poor stabilizers, inadequate protection, microtrauma. Coordination of these muscles and nerves must be sound for protection for normal function to occur. If not, injury may occur. In other studies, MRI changes in low back pain and leg pain, the multifidi are innervated by the medial branch of the dorsal ramus unisegmentally. So this is a branch that comes out of the spinal cord and then eventually out of the nerve root. And then there's a branch that innervates the multifidi. So if the spine goes out of place, then the nerve goes. And if the nerve goes, the muscle is not going to respond properly. So this is why adjustments and the therapies really help. It resets this stuff. It restores balance. So related to the lumbar dorsal ramus syndrome, this is basically when a nerve gets affected. It's just to exaggerate this, it shuts down. You shut down a nerve, you shut down a muscle, and now the muscle cannot respond adequately while it's trying to contract and stabilize. Abnormal motion, that's what we call a subluxation or a misalignment, will also cause this. Okay, now strength training, neurological training, adjustments, all these allow for increased proprioception, balance, endurance, and motor control, and also helps prevent and manage low back pain and chronic low back pain.